Clay, you want to introduce yourself?
All right, my name is Clay. I've just had the surgery on the front of my head a month ago, and I started getting headaches 2.5 years ago after a traumatic injury, a whiplash trauma, and I had a headache for 2.5 years straight, never went away. The worst part of my headache was I had this pain behind my right eye, like just my right eyebrow area. 24/7, I had the headache for 2.5 years, and from right when I woke up from the surgery, I had no more pain there. It felt like $1 million. It was pretty crazy. I still don't believe it. It's been 3 weeks. So for my first week, I had no pain at all, and then so far, since then, the past 3 weeks, I've had like 3 days where I had just swelling headache behind the right eye still.
Kind of similar to what you had before, right?
Just like what I had before. But I was just telling Dr. Lowenstein, like I could care less. One day there is nothing compared to, I literally didn't have a day without the pain for 2.5 years of some sort. So yeah.
That's great. And Clay, that's one of the reasons I wanted to have you speak is that, it's not always all or nothing. It's not, even in cases where we don't necessarily get 100% of the pain gone, I think you'd agree that it was worth it.
100%.
Yeah.
So worth it. And
we're still early, so I actually expect things to get better. But as the swelling and just inflammation from the and here, let's do this real quick. See, oh, I can't do that here. See, we don't have to. So as the swelling gets better, I expect that the episodes of pain will also improve, but they may not. And Clay may have occasional, bouts with this pain. But again, we'll do this again just to say that you said that over the last couple of days you think the swelling has gotten better.
I'd say this week, like week 3, it's from 2 to 3, it's gotten like significantly better.
Okay.
And
then over the last couple of days, how have you had a headache? When was the last time you had a headache?
Last time I had headache there was 4 days ago.
Okay.
And I still have head pain like in other places, but the worst pain is gone. Like that's like $1 million right there. I feel amazing.
And we talked about we're gonna now actually inject your occipital nerves, because I think that and we talked about this before surgery, that we thought you had probably involvement of the occipital nerves as well, and that might need a separate surgery. We'll block those now to see if we can get rid of some of the pain back there. Can you just close your eyes so people can see? There's still a little swelling, but the incisions are right there in the eye creases, and when he opens his eyes, actually I should say, he looks better than I do after my pickleball injury of my face bouncing off the pavement. But we're both smiling, which is great. So thanks, Clay, for doing this, and all good.